Okay, today we're going to be doing dressing changes, so you want to make sure that you bring your essential skills guide. It is going to be a sterile dressing change, so you're going to make sure that you bring your sterile gloves. You're going to need your kit. You're going to need an ABD pad if you don't have it in there, some way to measure it, so you're going to need a cotton tip applicator and a measuring device. If you don't want to use the tape in there, you're going to need tape and a pen. You're also going to need extra 4x4s possibly if you don't have them in your kit. We'll provide the normal saline, and then you're going to need clean gloves. We'll provide the wound, and we'll provide the table for you. So, okay, so this is going to be a sterile dressing change. So the first thing that we're going to do is we're going to remove our dressing. So we're going to put on our gloves. And if your rings are too high up, you may want to take those off so they don't rip your gloves. I probably should have. That would be a better idea. So we are going to, if we need to, pre-medicate our patient 30 minutes before if this is a painful procedure. Of course, go through all your general safety practices and all that, but I'm just going to get right to the skill right now. Tell the patient what you're going to do. Whenever you're removing the tape, you want to apply gentle traction against the tape. You can kind of tape it against itself. Tape and gloves is really fun. So as you pull that off, applying traction. If you need to moisten it or something, if it's sticking, then you can do that to get it off. If the patient's head was here, you'd want to lift it where it's not right in their face, just in case they do get kind of queasy with the sight of blood and things. So you're going to examine it. You're also going to take out the packing. So right now we're assessing just the dressing, looking at is there drainage, is there odor, how much is there, does it need to be measured, and then from here you can just wrap it up in your gloves and then just discard of it per facility policy. Does it need to go in biohazard? Where does it need to go? Right? And then this would just be trash, so you can set that aside. I'm going to go ahead and slip off my rings just because I'm about to do sterile gloving. Make sure you don't lose them. So then now I'm going to put more gloves on since I wrapped it up in there, and we're just assessing the wound. Are there any drains present? Jackson Pratt, Hemovac, Penrose, so you'd want to note that. You're looking at the wound, looking at the wound bed, the type of tissue. Is there granulation tissue? Is there slough? Is there eschar? Is it a pressure ulcer? Is it a surgical wound? Is it full thickness? Is it partial thickness? So just what kind of tissue is it? You're also going to be measuring it. So you're going to have your cotton tip applicator. So the length times width times height. Length is head to toe. We're pretending like the head is right here. So you can measure it in centimeters or millimeters generally. You just want to stick with the same measurement. If the other nurse has been doing inches, you can do inches, but usually we do centimeters or millimeters. So you would measure it length and then width. And then you're also going to want to do depth. So you use your cotton tip applicator, finding the deepest point, use your fingertip, and then you could either use this, or sometimes there's measuring on there, or you could use it to figure out how deep it is. Once you're done with that, you can set it to the side. You also want to check for undermining and tunneling, so you're going to use your Q-tip and feel up under there, feel for any tunneling. If there was, you would want to measure that, and then you could use the clock, 12 o'clock, 3 o'clock, 6 o'clock, to say there's undermining at 3 o'clock, 2 centimeters or whatever it is. So you want to note that. Then you can discard of that as well. All right, so we're also noting the skin around the wound, the peri wound, noting that. You want to note if there's a temperature, do they have pain, is there drainage, is there odor? So all those different things you want to assess the response to you touching it. So you're just totally assessing the wound. So that's kind of the end of step 3. Then I'm going to go ahead and remove my gloves because we're about to start the sterile part of the dressing. So at that point, you're going to have your kit. I'm going to go ahead and get my tape ready. You don't have to, but just I kind of like to, if I can find the end of it. Maybe not. Can we edit this part out? I can't find it. It's probably been sitting in my office for a year. There we go. All right, so you want to go ahead and measure it. You don't want it too long because you don't want to have more tape on them than needed. So only what's needed, so you know approximately what the dressing is going to be like. So it's going to be past the ABD. You can also put tape on the table first just to kind of keep it a little cleaner, and then put your tape on there. So I'll do that just to, you know, just to be a little bit cleaner. So I'll measure it again, stick that on there. So I'm going to do just 3 pieces, and it just kind of depends on the wound, how you're going to tape it. I'm just going to do 3 strips, but if it's really draining and leaking, then you could do it all the way around, or if it's in a place where it gapes open, it just really depends on the wound. You just have to, you know, decide on the best way to tape it. For this one, we're just doing this. And then you also want to, you know, put your initials, date, and time. So I'm going to go ahead and have that ready. All right, so now we are ready to start the sterile portion. So I'm going to open my sterile kit and then add anything that I need to it. All right. So you want to open away, and then the sides, make sure you fold it back properly. And then you want to open closest to you. I'm actually going to raise the table just a little bit. It's a little bit low for me. So you want to be at your waist height whenever you do sterile. So I'm going to raise it up. There's sterile gloves in here, so I can use those if I want, or you can use your own extra, but you always want to have an extra pair just in case. Remember, you want to always kind of stay at this angle, the like ballet position where you can see your field, you can also see your kit, and you don't want to turn your back on it. There's a no-fly zone. You don't want to be reaching over your sterile field. You want to try to stay off of it as much as you can. Now, you still have to work. I have to get stuff out of it and things like that, but you don't want to reach over it more than you have to. I'm just going to try to use these gloves, so I'm just going to slip them out through the point least, okay? So I'm just grabbing them here. I'm just going to set them right there. I'll put them on in a minute. Depending on your kit, this kit has some 4x4s in it already. If yours didn't, then you could add more, okay? So you'd want to open away, toss them on. I'll just show you just in case. This has plenty, but you would just toss it onto your field. Again, you want to stay off your field as much as possible, but you still have to put stuff on it. This one does not have an ABD pad, so I'm going to do the same thing. I'm going to open it. These are a little bit harder because they come out easily. I'm going to try not to touch it. I think this is from like the 80s too. Okay, so drop your ABD pad in there. We've got our normal saline or whatever you're using. You want to make sure that it's not expired, that it's the right cleanser that you're supposed to use. Place the label in your hand, take the lid off. We want to go from the around, you don't want to reach across, so I'm going to come over here and pour it in. I've got some 4x4s there, but I need some that are wet and some that are dry because I'm going to use it to clean and pack. I need wet ones. And you're going to need a little bit more, but then you need a couple dry ones to put on top. For this particular wound, I mean, all the dressings are different. This is just what we're doing for this one. All right, so we want to make sure, do we have everything that we're going to need before we put on our gloves? I've got 4x4s to clean it. I've got 4x4s to lay on top and an ABD pad to lay on top. I've got my tape ready, so I think I'm ready to put on my gloves. I like to just come down here. It's just more convenient for me to turn it this way. When you try to do it this way, then you have to worry about it laying over and that kind of thing. So to me, it's just easier to do this. It's not right or wrong. You just want to make sure that you know, don't contaminate. There's a right and a left on here. Make sure you practice. Just go ahead and get it down good. Can lift, you actually are going to grab the cuff of this one, okay, on the inside. Go ahead and lift it up. Look for the thumb. Slide it in. Then the other one, probably should take it off my bracelet. The other one you're going to slide in the cuff. So the first one you pinch, the other one you slide. Make sure you go ahead and lift it up because a lot of times people do this and they don't even realize. Okay, it's the gloves touching and they don't realize it. So go ahead and lift that up, and then you're going to look for the thumb. I missed it, but I can fix it now. See, I got it all messed up. But go ahead and fix it. Get the fingers in the right holes. Just be careful that you don't contaminate. And I wiggle it like that. So I've got my gloves on. You don't have to worry about that, okay? Just leave it. You don't need to throw it on the floor. Just don't worry about it. Keep your hands between your shoulders and your waist. So of course you don't want to tell the patient what you're going to do, but the first thing we're going to do is clean it. So I'm going to get some 4x4s, and I do have to reach over my kit to get stuff. Go ahead and kind of do them like this. And so when you clean, you're going to go from least contaminated to most. The center of the wound is considered the cleanest. So I'm just going to go straight down the middle. You want to try not to touch your glove to the wound. All right, so I'm just going straight down the middle. And then for my trash, I just like to kind of toss it right there, right? You don't have to, you can figure out another system, but you just can't put your hands below your waist. So whatever you do, you gotta just drop that trash. If you wanna do a little trash bag or something, that's fine, but you can't touch the trash bag, okay? But I find this works pretty good. So we're gonna clean on both sides as well. I don't think it really matters if you go away or near, but I'm just gonna go away, down, and then I'm gonna drop it. Get another one, and you of course want to make sure that you don't go over your sterile field. When you drop it, you want to go around it, and then I'm just going to clean down and drop. Okay, so we got it clean, and we're noticing how they're tolerating it. Now we're going to pack the wound. So you just want to, again, this would be wet. It makes it a little easier when it's wet, but we're just going to fluff our gauze. You can get it separated if you can. It's not cooperating too well, but you just want to separate it out. And then there should be cotton tip applicators in here, so we've got our sterile gloves on, so we can grab stuff. And then you want to put your packing in there. You can start at the end. Again, it works better when it's wet, but you want to use your you can use your other cotton tip applicator if you want to kind of push it down in there. You want to fill all the spaces and making sure that it's not hanging over or too high. You want to push it down more, not overlapping over the sides where it could cause the maceration. So make sure it's packed. We'll go ahead and throw these away. And that was with the wet 4x4s. And then you're going to place just 2 dry 4x4s. Okay. Over. Over. And again, remember, you don't want to cross your hands, so if you need to grab something, you need to, do it correctly where you're not, crossing your hands over. We've got our ABD pad. It's got a little flap on it for you to be able to hold it, and so we're just going to cover it. At that point, the sterile part's over. I'm going to leave my gloves on, but I'm not so nervous now. So I just need my tape. I've got my time and date sticker, and of course that's the patient. Make sure and evaluate how they're doing. But the end.